I am Dr. Prabir Kumar Gupta, Senior Consultant Cardiologist of GNRC Dispur Hospital. Today, on occasion of World Heart Day, I want to give some tips for the prevention of coronary artery disease. How to prevent the coronary artery disease. Basically, we know that coronary artery disease is a disease of the artery of the blood, artery vessels of the blood, where there is deposition of cholesterol-like things into the arteries, lumen of the arteries, causing narrowing of the artery, ultimately leading to less blood supply to the area and thereby going to cause the development of ischemia and necrosis of that area, or even heart attack, whatever you say in the common level language. Now before that, this how it occurs I have told already. How it can be prevented could be seen. First is it can be prevented in the primordial level, where there are modifiable factor, non-modifiable factor. Non-modifiable factor means those who are genetically predisposed, those who are having familial history of coronary artery disease. These are non-modifiable. They cannot be modified. Hence, once in a blue moon, they may develop the coronary artery disease. And the primary prevention level, we can prevent this heart disease. So first of all, thing is that we should have to control our blood pressure. First is the proper medications to be taken for control of blood pressure. With medications, the blood pressure should be controlled. It should be well controlled and below 140/90. Second is diabetes. If someone is having diabetes, it should be well controlled by the by the medicines or without medications, and the lifestyle. Third is the main and more is the lifestyle modification, which should be done from the younger age group onwards. First is avoidance of junk food, quit smoking or tobacco in any form. Third, proper exercise in a week, that is 30 to 45 minutes per day, 5 days in a week. If someone cannot do properly 30 minutes per day, he should divide this into 10 minutes, 10 minutes, 10 minutes, which should be done for 5 days in a week. Fourth, proper food habit. Avoid junk foods. This should be properly avoided. Then they should avoid the smoking. They should avoid the stressful anxiety and life. Then mental stress, via meditation, yoga, or all that things. Then proper sleep, 7 to 8 hours per day. Then avoid stress in any form, mental stress. That should be avoided. Okay? Then familial history, if it's there, he should be proper conscious regarding all this. Reduce body weight, reduction of the body weight. If someone develops these symptoms like chest pain, chest discomfort, heaviness, shortness of breath, or even tingling sensation or above the level of the umbilicus, means above the umbilicus, any sort of symptoms related to exertion should not be neglected. Should not think of it's a simple mere gastritis or like these things. If he is having those risk factors, he should be properly investigated, should immediately should consult a cardiologist, do a necessary test, whatever they will give, and go accordingly. The normal investigations, what we usually do for a coronary artery disease patient, first of all, we go for the blood test like hemoglobin %, sugar, his kidney function is alright or not. And if symptoms of heart attack is present, then we go for the cardiac biomarkers. If those are positive, then we go for the other tests also. But other test means ECG, echocardiography, if required treadmill test, if required coronary angiography, depending on the symptoms. After coronary angiography, the proper evaluation of the coronary disease is done. Coronary angiography reveals what sort of coronary blockade it is present, whether it is simple microvascular level or there are numbers of how many blockades are there. Accordingly, the therapy is given, which depends medical therapy, medicines therapy, which is you have to take lifelong, because these are all preventable, not curable. In future, there is chances of future again arrival of the disease. Second is depending on the number of blockade and all the things according to the indications, angioplasty, what we saw the ballooning or the stenting, and the third is coronary CABG operation, that is bypass operation. So these are the modalities for the treatment which are available in here also in this book GNRC. So the thing is that a heart disease should not be neglected. It should be prevented at the primary level only before the occurrence of the symptoms. Means whenever the patient will get a alarming sign of this type of symptoms, what I have seen previously said, and having the risk factors. So hope you understand what I mean, that we can prevent this disease in the first level only. So hope for that you understand also what I have said today regarding the prevention of the coronary disease. So with this I want to end this topic. Stay happy and be healthy and avoid those things what I have already said. So that's my ditto today only.